and it's hard to compute the sorrow contained in that grim statistic.
On the 26th of January 2021, it was announced that the United Kingdom had surpassed 100,000 COVID deaths. During this time, the government urged people to stay at home as much as possible. People were told to only go out if it was absolutely necessary, and to only meet people within their bubble.
Once more, we must all stay home. If it is essential to go out, remember, wash your hands, cover your face indoors, and keep your distance from others.
But the hundreds of thousands of lives lost is a lot more than a mere grim statistic, as our Prime Minister suggests. All those lives lost have affected individuals and families across the country, grieving the deaths of their loved ones.
It's that sort of dealing with that as well, where it's like, if COVID hadn't happened, would he still be alive?
In the first lockdown, my mother sadly passed away in March, and my father then passed away 3 weeks later in April.
These people have suffered what researchers describe as COVID grief, argued to be worse than other types of grief. So, what exactly is COVID grief? Research has shown that loved ones who have been bereaved by coronavirus have experienced greatly increased negative experiences and show higher grief and support needs in comparison to people who have suffered the loss of a loved one from other illnesses. The pandemic has created what some would call an epidemic of grief. I will be speaking to those who have suffered and are still suffering from a bereavement over the pandemic, and the charities and organisations who want to help.
Something that has been, I think, life-changing for such a huge amount of people in the UK. I don't know if that's as recognised as it should be at this stage.
COVID grief and grief. So what is the difference? Well, there are people who have been trying to answer that very question. Dr. Emily Harrop and Dr. Lucy Salmon are the two researchers behind COVID grief. Their study found that 70% of bereaved people who lost a loved one to COVID-19 had limited contact in their final days. 85% were unable to say goodbye in a way they would have liked, and 75% experienced social isolation and loneliness. I spoke to Dr. Emily Harrop from Cardiff University about the study into COVID grief.
People who experienced bereavements through COVID were having often to deal with the fact there was a very sort of sudden, unexpected death, which is traumatic by itself for people. We knew that from previous work in the field. But then all of the restrictions that were put into place, so not being able to visit relatives in hospitals or care homes or hospices, presenting themselves sort of grief issues for families, really not being able to say goodbye, not being able to sort of provide the sort of physical comfort that they would like to ordinarily would have done to their family members. And then, of course, the restrictions to funerals and memorialisation practices, restricted at, not being able to see friends and family, get the support they want from friends and family. So it's this whole, and then just the general, extreme societal disruption, really. So it's this whole suite of different circumstances.
Grief itself is painful, but under COVID, there were factors preventing people from properly saying goodbye and visiting their loved ones in their last days.
Participants talked about was just feeling that nobody who'd, unless somebody else had gone through the same, they couldn't possibly understand it. So within our participant sample, people, perceived it to be a very unique type of grief that they were going through, and that made it harder then for them to connect with and share their experiences with friends or family, people who hadn't been through that. I think they felt that there's just no way that they could understand what they were going through.
According to The Guardian, on the basis that a typical person dying leaves 5 people bereaved, the researchers estimated that 2.6 million people have been bereaved in the UK at a time of profound disruption to our social support networks, as well as intense pressure on health and social care. One of the people that knows exactly what living with COVID grief is like is Hannah Jones.
It was the start of my second year, so the October, right at the start. My dad just passed away really suddenly. In a way, I think that as much as I think if my mum died because she's my rock, if she died that would be worse because I can't even imagine. It made it really difficult because it was COVID plus like guilt because you're not talking to them. And it was weird because he lived on his own, and on just a human level, it's horrible to think that somebody died on their own. And if it hadn't been for COVID, he potentially might not have, because it cancelled an operation he was supposed to have. He had heart problems, and because of COVID, he's supposed to have an operation on his heart, and he got cancelled, and it's what killed him, his heart.
She didn't get to have a funeral for her father, and she even had to self-isolate when she first got the news. During the peak of the pandemic, the number of people permitted to attend a funeral were limited to the members of the person's household and close family members. A survey carried out by Cardiff University's Mary Curie Palliative Care Research Centre and the University of Bristol found that restricted funeral arrangements were challenging for those grieving. Dr. Emily Harrop described the restrictions as a disruption to the grieving process.
And not being able to hold usual funerals or complete usual rituals. I think for some people feel that the grief process hadn't sort of started in the same way that they would have expected to, or that people talked about their grief being on hold or delayed, or because they hadn't really been able to go through those usual steps. I know some people talked about wanting to try and do something later on for their relatives, but then I suppose in that sense that's kind of putting it on pause as well, because you're still waiting to have that event. So it's just this real sort of disruption to the normal grieving process, I think, and also not being able to sort of collectively get together and talk about family members and share their memories, which is another quite important part of being able to start processing the loss.
Hundreds of thousands of people have experienced a COVID-related bereavement over the course of the pandemic. But who is out there to help them? If you were to search into Google grief and bereavement help, you would find various links to people out there who want to help you. On the other hand, if you typed in COVID grief help, there isn't an awful lot to work with. But there are counsellors and charities out there who specialise in COVID-related grief and want to help. Meet Gavin Perrett. He is a mindset transformation coach and grief therapist, who also specialises in helping those with COVID-related grief. Back in 2020, he experienced COVID grief firsthand after losing his parents 3 weeks apart to the virus. He has since turned his loss into becoming an advocate for grief recovery.
This was the first time that it had impacted me personally on a very, very immediate level in my immediate family. Given the nature of what was going on with COVID, lockdown, so on and so forth, it was a very, very different landscape and very unpredictable, very sudden, no time to prepare. So I was kind of very much thrown into the lion's den with that, and had to cope with my own grief journey very much alone due to the nature of what was going on at that time. And after a period of time, I started to develop my work as a coach, and I thought, you know what, I think it'd be really good for me as well as other people if I could develop a grief recovery program. And by designing that program, I helped my own grief recovery journey, and I'm now helping other people navigate their grief journeys as well.
The NHS suggests, when dealing with bereavement, grief and loss, to try and speak about your feelings, whether that is with a friend, family member or counsellor. But during the pandemic, it wasn't that easy. Hannah had to self-isolate during the very first days of hearing about her dad's passing.
Found out, well, to be fair, this is actually how I found out when my dad died. I was at uni, I was here, and they had to ring me, and I couldn't go home for a few days because my friend in my house had COVID, and so I was having to isolate with them. It was 4 days of just my family are at home grieving together, and I'm stuck here.
Gavin isn't the only person helping those deal with grief. There are other people out there who have been helping those in need in a different way. I spoke with Sylvia Tillman, a certified TRE specialist. TRE stands for Tension and Trauma Releasing Exercise, created by Dr. David Bercelli. Sylvia rediscovered TRE during the pandemic and has been using these exercises to help people dealing with grief.
With TRE, you can release the tension you hold in your body. So especially people, and I've worked with quite a few people who've lost somebody, they feel they tense up. They want to be strong to get through their grief. They might clench their teeth, or they might hold everything together and then have trouble with their back or their shoulders. Very, very typical, because we are kind of meant to perform and go on with life and so on and so on. But with TAE, you literally shake it off.
One thing we must remember, there is no linear way to deal with a bereavement. COVID grief has affected millions across the United Kingdom, and people are still dealing with the effects the coronavirus pandemic has left on them. COVID Aid is the United Kingdom's national charity dedicated to supporting those who have been significantly affected by COVID-19. Michael McLennan is the founder of COVID Aid, and following the December 2020 lockdown, he set up the charity after feeling helpless from seeing how many people were still being affected by coronavirus.
We recognise that people have been hit in a variety of different ways. Some of those most significant ways are through grief and bereavement, through long COVID, through the effect on mental well-being, financial hardship and other issues as well. And what we've been looking to do, and what we've done over the course of the past year, is build a supportive network. So we've reached more than 100,000 people through our website. We've got a support community that provides Q&As, webinars, courses and other resources to help people. And then we've also had more than 60 volunteers involved in the charity. So one of the things that has been really great is often people visiting COVID Aid to find support upon visiting us will then become part of the charity themselves and then support people who've been through similar experiences.
The frustration towards the government's handling of the pandemic is still commonly spoken about. Out of this frustration has come anger. In December of last year, the scandal of the number 10 Christmas party went public. Since then, it has been reported that 20 gatherings took place in and around Downing Street during the national lockdowns. Looking back, it begs the question, why were those who set out the legislations of limiting the number of people at funerals the ones who were having a party while we were at home grieving? Sue Gray was appointed to lead the inquiry into the lockdown parties. Her report found failures of leadership and judgment in Number 10 and the Cabinet Office, and said that many of these events should not have been allowed to happen.
And then finding out that Boris Johnson was getting drunk, going out drinking and partying and setting these rules. And I think that's what is the worst bit, is the fact that he made these rules.
The conversation behind COVID grief still needs to be had. Even if coronavirus isn't as prevalent in society today as it has been in the past 2 years. COVID grief is something new, and we need to consider how we can tackle it in the future by ensuring that those bereaved know exactly how they can get help if they are struggling, and know that they are not alone. In this documentary, we have seen how people can be affected by COVID grief and spoken to those who want to help. One thing we should not forget is that people are grieving, and that will remain for a lifetime.